Growing older comes with its ups and downs, and there are certain body changes that come along with it. And eyelids are no exception to this rule. And so when do eyelid changes start becoming a problem and you need a bit of that tack just to get it right? And this is the topic we'll be discussing today. This is the Dr. Tebz Show, where we're putting your health into your hands. My guest today is Dr. Mpopi Lenake. She is a qualified ophthalmologist who is operating out of Somerset West. She has a special interest in oculoplastics and orbital surgery, which means eyelids and eye sockets. Thank you so much, Dr. Lenake, for joining me today.
Thank you for having me, Dr. Tebz.
Yeah, this is a very interesting topic because, we all grow older and some people feel like it's vanity. Like, I'm feeling quite vain to want to change some things that I'm seeing happening on my face. So when it comes to eyelids, can you just describe a little bit about what are some of the changes, people notice around their eyes as they grow older?
Okay, so what people usually complain about is excess skin. So they complain that they have these heavy drooping lids that are getting in the way. And then they also complain about bags below the eyelids.
Okay. So now if a person is having this, when is it a bit too much and when would you consider actually intervening and helping them?
Okay, so it's considered a functional problem if it's causing visual field problems. So if you have excess skin that's resting on the lashes, it becomes heavy. And so a lot of people then use these muscles to try and elevate the lids. And then the visual field, especially all the way around, peripherally, becomes affected. So it's actually a functional problem. It's not a cosmetic issue at all.
Oh, okay. And in your practice, who are the people who commonly come seeking help from you?
Well, I see men and women who have this problem.
All right. And, as Africans, we say black don't crack. But is that really true? Do African people also come and say,
yes, they
Doc,
do.
there's something wrong?
Yes, they do. This is a problem that affects everybody.
Okay, all right. So it's a universal problem.
Yes, it is.
Okay, so what are some of the surgical options or what are some of the surgical procedures that you do for fixing, as you say, the heaviness and the skin laying and the eyes looking puffy?
Okay, so regarding the upper eyelids, you can remove the actual excess skin.
Okay.
And then what usually happens is that the eyebrows are also low. So often you need to lift the lateral brow as well, and that can be done at the same time. Some patients are happy to have just the upper eyelid surgery done, but some people do want the lower lid surgery to be done. Now that is considered cosmetic because it doesn't have any visual function or doesn't cause any visual dysfunction. So if you have bulging fat and that puffy look, that can be addressed as well.
Okay, and so someone's thinking, okay, so what is the success rate? Will I have to go back in? Will it come back? Or once I've done it, that's happy days.
Well, I mean, skin evolves and continues to age, but most people find that the results last about 10 to 15 years and they don't need any repeat surgery. One has to be very careful about removing too much skin. It's a fine balance. If you remove too much skin, then the eyes won't be able to close afterwards. So you need to be very cautious.
All right. So
yes.
You have alluded to complications. So I'll ask this in a two-part question. What are the complications and how long does it take a person to heal that they feel that, okay, I'm back to, my youthful self?
Yes. So, this isn't considered major surgery. There are some people that perform the surgery in the procedure room in their office, but I perform it in theater. So the complications are really, really mild. You can get bleeding during the procedure, but usually that's mild, and we used various equipment and instruments to stop bleeding. The infection rate is very, very low. We use antibiotic ointments that we apply to the stitches and the wounds. as I said before, if you remove too much skin, then the lids won't be able to close properly, and then the surface of the eye can become dry. And those are the major problems. That's with upper lid surgery. With lower lid surgery, it depends on the approach. So a long time ago, most surgeons used to approach it externally. So they used to make a skin crease incision, and that was associated with the lid actually like drooping, drooping afterwards. So most surgeons don't do that approach anymore. We approach it from the inside out to try and preserve the ligaments of the external skin so that it doesn't sag.
Okay, that's good news. So there've been developments.
Yes.
No, that's great. So now, if a person is like thinking, okay, you know what, I'm having this, my visual field here is dropping, where can they go? Yes, you have your beautiful practice in Somerset West,
yes,
but where else can they go? You know, in government, in private?
Well, I'm not sure how many government facilities perform this operation because they're much more urgent, cases that they have to deal with. But ophthalmologists, especially those that are trained in oculoplastics, are the best people to treat this because they understand the ocular anatomy the best. I do know some plastic surgeons also do perform this procedure.
Okay, all right. So as always, any closing thoughts on this topic?
It's something that's very common. It's something that causes visual dysfunction, and you can get help for it.
Yeah. So don't feel ashamed.
No.
Don't be like, I'm being vain.
No. It's not a cosmetic issue at all.
No, thank you for that very reassuring message for all our viewers back home. And so thank you for also joining me today.
Thank you.
And thank you viewers for watching this episode. If you'd like more information on this topic, please leave your comments below. If you'd like to contact Dr. Lenake, we will leave her contacts in the description box. And if you want to see more episodes like this, please do like, subscribe, and push the notification button so you will know when we upload our next episode. Until next time, take care of yourself, take care of others, and remember, your health is in your hands. God bless.